If you are pregnant or you've recently had a baby, this podcast is for you. I am your host, Kath Bequee, a physiotherapist working in women's health and mum of three. Inside my online program, Fitness Mama, I just love helping support women to care for their bodies during pregnancy, prepare their bodies for birth, and support their after-birth recovery, helping them feel confident and strong inside out during this important stage of their lives. In this podcast, join me each week as we dive into all things pregnancy care, childbirth, and postnatal recovery, helping you through every step of the journey. It is absolutely possible to feel amazing and confident in our bodies during this motherhood journey, and I want that for you. Come and say hi to me on Instagram at FitnessMama, and let's dive into today's episode. Hello and welcome back to another episode of the Fitness Mama podcast. Today's episode is all about tongue tie, and I speak to Jacqueline Kincer, who is a passionate advocate for breastfeeding and founder and CEO of Holistic Lactation. And she also has a podcast herself called Breastfeeding Talk. So this conversation about tongue tie, it actually blew my mind. I didn't realize the flow-on effect that it could have in a baby and adult's life. And I have actually, after finishing this podcast episode with Jacqueline, I said to her, I actually pulled myself back from asking all about how tongue ties affect adults, because I thought, you know what, no, that's not in the scope of this podcast. And I said that to her. I said, I had to stop myself from asking you about how the tongue tie affects adults, when the babies grow up. And she has kindly she's given me a link to a podcast episode. So if you're interested in hearing how tongue ties can affect babies as they grow up, or perhaps yourself if you're an adult and you've got a tongue tie, then click the link in the show notes and that podcast episode is there for you. So in this podcast today, we talk about, Jacqueline discusses what is a tongue tie and how it affects the ability to breastfeed. Jacqueline talks about the signs and symptoms of a tongue tie, how it can be diagnosed, and we talk about the treatment options too. And it's perhaps not as all the treatment options available are perhaps not quite as you would have thought. Well, they were a lot more varied than I had initially thought. So brilliant episode. I trust you're going to love it. Send Jacqueline and myself a DM on Instagram at FitnessMama and let us know if you've listened to this episode. But before I do dive into this episode, I do just want to thank you all once again for supporting this podcast along the way. It is now over 2.5 years old. We've released over 140 episodes, and this podcast is now listened to in 99 countries, to be precise, nearly 100 countries around the world. So thank you so much for your support, sharing this with your pregnant friends and new mum friends too. And thank you for all the ratings and reviews that this podcast has been receiving lately, because sharing, rating and reviewing this podcast is probably the most important way to help this podcast reach more people. And at the end of the day, that's what it's all about. It's helping you have a wonderful pregnancy, birth and motherhood experience. So thank you all once again. Right, let's dive into this episode with Jacqueline. Jacqueline, thank you so much for joining me on the Fitness Mama podcast. We are chatting all things tongue ties and how that affects breastfeeding. So it's a really great discussion we're having. So thank you so much for taking the time out to chat today. Can you please quickly introduce yourself for those who haven't come across you before?
Yeah, absolutely. I'm excited to be here and I love shows like yours. So yeah, for those who don't know me, I am an IBCLC. So that's an international board certified lactation consultant. I'm the owner of Holistic Lactation. So we do virtual appointments. In fact, we've had a ton of Australian clients, believe it or not. And then we have some herbal supplements, which aren't available in Australia, but in the US. And so those are for milk supply and things like that. And then I have a podcast, the Breastfeeding Talk podcast. And then we have some online courses for breastfeeding as part of our program called the Nurture Collective. So we do all of those things online to support moms with breastfeeding. And really, I would say my area of passion is tongue ties. And it's really, I didn't know it at the time, but the reason why I got into this work and what I do, because I kept looking for answers as to why breastfeeding was not going so great with my first baby. And so ultimately I realized that it was a tongue tie and a lip tie.
Okay.
So yeah, it's just been an area of passion of mine. I've been in practice for 7 years now. And gosh, I've seen so many different families, so many different situations. And yeah, it's been incredible.
Yeah. Oh, brilliant. So let's start off with just the basics. So everyone's on the same page. What is a tongue tie and how does it affect the ability to breastfeed?
Yeah. So a tongue tie is, well, I'll start off by defining what a frenum or a frenulum is. So that is the band of collagen tissue that is underneath the tongue. It connects the floor of the tongue to the floor of the mouth. So everyone has one. They're totally normal. You also, there's other frenulums inside our bodies as well, but there's other notable ones in the mouth. So the center of the upper lip, that connects to the upper gums. The center of the lower lip connects to the lower gums. There's what's called buccal frenums, and those are on the sides of both the upper and lower jaw, connecting the cheeks to the gums. And then your heart has a frenulum. Your genitalia typically has a frenulum, especially if you're a man. So they're in our bodies. They're there for a reason. And they're to kind of hold things together so they don't move too far apart. But a tongue tie is a frenulum that is abnormal. So there's a few different types of collagen. So a tongue tie is a particular type of collagen that is not stretchy. It is not flexible. So there's restriction of movement already. And a tongue tie is also something that happens when the baby is in utero. It's very early on in the embryo stage. In fact, tongue tie, it's all decided really before 16 weeks gestation. So a lot of parents will ask me, was there anything I could have done to prevent it? And I'm like, not really. And even if there was, you may not even know you were pregnant until it's kind of said and done. So it's really an incomplete process of cell death. So there's really a full attachment between the tongue and the floor of the mouth. And as that baby moves forward in each embryological stage up to 16 weeks, that tissue is kind of deleted and those cells die, but not enough of those die. And that creates a tongue tie or a lip tie. So yeah, it's really, the difference between a frenulum and a tongue tie is that one is normal and allows a full range of motion, and the other is abnormal and restricts motion. So when it comes to breastfeeding, tongue tie causes a number of problems, from a poor latch, inability to maintain a latch. Sometimes it's the inability to even latch at all. It can cause swallowing of air during feeding, whether that's breastfeeding or bottle feeding. It can cause difficulty with bottle feeding. It can cause a lot of tension in the jaw, in the shoulders, in the entire body, because it can affect posture and in the way that the baby is positioning themselves to try to, come to the breast to feed. It can cause an incorrect swallow. Oh my goodness. There's so many things, but those are probably the main things. I mean, it can cause for the mother, it can cause, pain during nursing. So cracked, bleeding nipples, that type of thing, misshapen nipples. It can cause clogged ducts, plug ducts, mastitis, because the milk isn't being drained from the breast as effectively. And in fact, if the tongue isn't moving properly, it can actually push milk back up into the pores and the ducts in the nipple and into the breast. We've actually witnessed that on ultrasound. And so that can cause clogged ducts and inflammation and mastitis and things of that nature. It can cause low milk supply because milk is not being removed as efficiently or as effectively as it could be. So there's so many different issues that we would see in breastfeeding caused simply by a tongue tie.
Yeah, wow. Okay. That was a lot of information you provided. And I'd just like to go back to when you were saying how the baby's developing in the womb. Is this a genetic condition or does it just happen randomly through that development process. This episode is brought to you by Baby Bee, Australian-owned and designed prams combining quality, safety and style. Not only does Baby Bee let you try their prams at home with free returns for 9 months, yes, that's 9 months, they also offer an industry-leading 3-year warranty for total peace of mind. With thousands of 5-star reviews, around-the-clock customer care, and up to $300 of free accessories with every pram, what are you waiting for? Go visit www.babybeeonline.com and check them out for yourself. And yes, for listeners of the podcast, there is a 20% discount code. Enter FITBEE, FITBEE 20 at checkout, and T's and C's apply.
That's a really good question. As much as we've been able to research and piece together, it is fair to say that it's a genetic condition. So I have yet to see a baby with a tongue tie that doesn't have one or both parents that also have a tongue tie. So a lot of times, the symptoms in older children and adults will be different because they're not feeding in the same way that an infant does, and they're speaking and there's other things going on, but they're there. You just have to know what to look for. So yeah, it's very hereditary, passed down. And that's how a lot of parents figure out that they too have a tongue tie, is when we find it in their babies.
Right. Okay. Well, let's go into some of the signs and symptoms of a tongue tie. So if a mother is breastfeeding or you've got a parent, what are some signs that might alert them to the fact that perhaps there's an issue here?
Yeah, I would say really, it could go any which way, right? And so you don't need all of these symptoms for your baby to have a tongue tie. You don't need all of the symptoms all of the time or at every stage of breastfeeding. So what I mean by that is I've absolutely seen babies with very visually obvious tongue ties that are nursing great right after birth and getting colostrum and big gulps of it and doing really well. But then over the course of the next 2 weeks, there's other symptoms that begin to present themselves. And so I think it's important to remember certain principles about lactation. One is that, immediately after the birth, you don't have this abundance of milk, and that's on purpose. You have colostrum, it's in smaller quantities than mature milk. So when that's the case, sometimes it's easier for babies to manage the flow because it's not as fast. Sometimes it's harder for babies because they can't get the milk very well. So those babies that find it easier when your milk sort of comes in and now you have this abundance of milk, they aren't doing so great. Whereas the opposite might be true for another type of baby. So it really just depends. But I would say, it could be anything. And there's other reasons why these things can happen besides a tongue tie. But, they're not latching. They're struggling to latch. They're struggling to stay latched. I would say that really an easy red flag is pain during nursing. If it's hurting, if it's not just tender and maybe feels uncomfortable, but there's actual pain involved. And especially, I don't think that any mom who's breastfeeding and that's experiencing pain isn't trying to troubleshoot it. Like they're trying to work on the latch. They're trying to figure something out, the positioning, whatever, right? Like if you've done the work to try to get that going as well as possible, but it still hurts, or you have scabbing or bruising or bleeding of your nipples, it's very likely that it's something like a tongue tie. It's really rare that I've seen nipple damage be caused simply by a latching technique or positioning. I would say that's almost something I've never seen. So you can have pain and soreness, but I wouldn't go that far. So that's an easy red flag. Babies that just don't, they prefer one breast over the other. Babies that have a lot of reflux, babies that seem colicky. Those are some really big red flag symptoms that are often mistaken for a food allergy or a food intolerance. But colic and reflux are not allergy symptoms in and of themselves. So it's really important for moms to make that distinction and not blame themselves and eliminate all these foods from their diets when realistically, it could just be a tongue tie. The baby is swallowing air. That air comes up. It brings milk with it. or it's in their tummies and it's causing discomfort. And that's why they're screaming their heads off. And that's why they won't eat. And so that's a common issue as well. So there's other little ones I kind of mentioned, but really I would just say, poor latch, your low milk supply dropping anytime between 6 and 12 weeks postpartum. That's another big clue. So your milk production is driven by hormones after birth. And then between 6 and 12 weeks is when it shifts to how well your baby is removing milk from the breast. Or if you're pumping, it would be decided by that. So if nursing's been going okay or fine, but all of a sudden your baby is frustrated and seems hungry every time they come to the breast, and they latch and they cry and they latch and they cry, and you're going, oh my goodness, my milk is just drying up. No, it's not. That won't happen unless, something has biologically changed with you to a really great degree, typically like a medication that dries up milk or something like that. It's very often something like a tongue tie where the baby was just never very efficient and was just kind of coasting by on your hormones driving milk production.
Yeah. Amazing. So it's really good to be aware of this as a possibility, because what you're saying, I now want to check out 2 of my children out of 3. I'm like, oh, maybe that was the issue. So the next question is, how is it diagnosed? And are we able to see ourselves, or is this something we need to go and consult with a doctor?
That's a really good question. It's all of the above. So here's where, I think that I never want to disempower a family or a mom, but at the same time, I think that there has to be a respect and medical expertise being held in a somewhat high regard, because if that's not your training and you don't know what to look for and you don't know how to properly assess and examine, looking under your child's tongue and determining whether or not they have a tie, that's not how it works. That's not what we do when we're assessing and diagnosing. So, it's kind of there's a lot of pieces that kind of fall into the answer to this question, which is that assessing and diagnosing a tongue tie is not done just by the appearance of the tie or the frenulum. That you cannot send somebody a photo and say, is this a tongue tie? Maybe if it's attached to the tip and it's very clear the tongue cannot elevate from the floor of the mouth at all, yeah, I could definitively say that's a tongue tie. But at the same time, a photo is a still picture. It's not in motion. So how does it affect the tongue movement? Because again, we all have a frenulum, but whether or not it's a tie is dependent on if it causes functional problems. So when we say functional problems, we mean, the proper motion of the tongue. And so it's really important for the tongue, especially when it comes to breastfeeding, but this also plays into things like speech and breathing and swallowing later on in life, is that the back of the tongue is able to elevate to the roof of the mouth. So the tip of the tongue we don't really need that to move when it comes to breastfeeding. We need the back of the tongue to move. The tie is always going to be attached at the back of the tongue. It may or may not be also attached at the front of the tongue. So there's this whole idea of an anterior tongue tie and a posterior tongue tie. Every tongue tie has a posterior component. Not every tongue tie has an anterior component. So if we don't have that proper elevation, and that's really hard for a lot of parents to assess, even having a baby suck on a finger can tell us some information, but their lips are kind of closed. Their mouth is not as wide open as it would be if they were on the breast. When I assess, there's mechanical things I look for. I look for the ways that the musculature of the baby's face and jaw and even their neck move. There's certain muscles that should be activated and moving when a baby is breastfeeding versus bottle feeding. When I work in person, I have a stethoscope that I use to listen to the tongue movements and the way that the swallows sound. And that gives me the most information. It's as accurate as an ultrasound to do something like that if somebody is well trained. But I would say it's important that you get a functional assessment if you're wondering whether or not your baby has a tongue tie. And that can only realistically be done by an IBCLC or somebody that has training in breastfeeding and understands infant oral mechanics. If you go to a pediatrician, the pediatrician understands babies. They rarely understand tongue ties, and they certainly don't understand lactation and breastfeeding. That's not their training. They're there to, examine and care for the infant. They're not there to examine and care for you, the breastfeeding mom. So I think it's just really important distinction to make, right? And IBCLCs, it's an international credential, so we're all over the world. There is, some standardization of our education and training. However, there's, kind of only a subset of us that I would say are really truly skilled in this assessment and treatment of ties, because treating ties isn't just about doing a surgical procedure to cut that frenulum. It's also about retraining that baby's mechanics so that they stop using their tongue in a way that they've known since they were in the womb to a new way that they've never tried or practiced before. And how do we get that baby to do that? It's not simply a matter of fixing the latch or the positioning. It's not just having them suck on your finger and do suck training. Like, there's way more to it than that. And so a lot of parents will just go and get a surgical treatment, but they don't do all of the other sort of, physical therapy kind of stuff that they should be doing to get those breastfeeding mechanics up to par.
I didn't realize that diagnosing was so complicated. I thought just have a little look. Okay. Amazing.
Yeah. I wish it was easier. I do, because it would just be, but it's not. Yeah.
Okay, I've got so many questions, but one, I'm putting you on the spot a little bit, but is there any, do we know, apart from breastfeeding, are there any long-term potential complications with tongue tie? I know you mentioned speech there, but what are the known complications, potential complications, I should say?
Yeah, absolutely. There's quite a few, and actually there's some great books on this. Maybe it's okay if I just share the author's name, but Dr. Shireen Lim, she's actually an Australian dentist, and she wrote this book called Breathe, Sleep, Thrive. And she's great. I've actually met her at a conference. Her book answers that question super in depth. So if you really want to know, but realistically, speech is one. Posterior elevation of the tongue is what we use to create R sounds, at least in my version of the English language, but yours as well. So depending on your dialect, right, there's variations. Lots of people can compensate for their shortcomings. So meaning, you could have a tongue tie and you could make an R sound that sounds as clear as the one that I'm making, but you have to put extra effort into it and you're straining to do it. And it's unconscious for you at this point because you just learned this pattern, right? So there's things like that. Speech is going to be something that we notice more in children, where they're often referred to speech therapy or something like that. But there's other things. And I would say the most important thing to recognize with a tongue tie is the impact it has on the airway. And this is true no matter what the age, it just evolves over time. So the posterior part of the tongue, the back of the tongue, it's supposed to rise up to the roof of the mouth, the palate. When that happens, there's two parts of the palate. The more forward part, the anterior part, is the hard palate. Behind that is the soft palate. The hard palate doesn't move. So that's the floor of your nasal cavity. And actually, the tongue is what shapes the jaw and the entire midface. So the tongue is not just one muscle, it's a set of muscles. And the way that it works when it's feeding, when it's talking, but more importantly, when it's at rest, is so important. So at rest, the whole tongue should be suctioned to the roof of the mouth. If that's not the case, either the muscles are weak or they're untrained or they're trained improperly, or there's a tongue tie that's preventing them from doing that. When the tongue does not rest on the palate, it's like a scaffold. Then the palate doesn't grow wide and broad and flat. It grows upward, like a church steeple, and it's impacting then the nasal passages. So instead of those nasal passages having the space that they should, they're narrowed and they're squished because the palate is now coming up into that space. So if our nasal passages are more narrow, anytime you have any nasal obstruction, whether it's some random boogers in there or you have allergies, you're going to be more prone to mouth breathing. Mouth breathing requires us to keep our tongues at the floor of our mouth. That weight resting on our lower jaw brings our whole face down. So if you're chronically mouth breathing, if you're mouth breathing during sleep, if your tongue is not in the right position, you're changing the entire growth of your face, but also your airway. And so what happens is if the tongue is on the floor of the mouth, it's further back in the throat. So it's occluding the airway. When you lay down to sleep, especially if you sleep on your back and your muscles are relaxed and you no longer have conscious control over them, your tongue can fall back and occlude your airway. This can cause snoring. It can also cause apnea episodes. So sleep apnea is a really big issue that is terrible for your cardiac health, for your brain health. And it's often unrecognized because it's such a tricky diagnostic criteria. You have to stop breathing several times an hour to be considered to have sleep apnea. I don't know how many times an hour you're okay with not breathing, but I feel 0 is what we should be aiming for, not 10 is okay. So when they go do a sleep study, they're like, oh, you're fine. You only have an AHI of 6, but should you stop breathing once every 10 minutes? That doesn't make any sense. So anyway, we have a long way to go with sleep medicine, but that's a huge impact. And truly though, if your airway is somewhat obstructed, you can breathe, but you're over breathing. You're working harder to breathe and you get tired more easily. We have absolutely seen in children, and I'm sure adults as well, this just hasn't been well studied yet, but symptoms of ADHD. That your brain, it's not getting the right oxygen, CO2, nitric oxide concentration. You're having to work harder. You're almost, kind of just over breathing to compensate for the struggle that your body is unconsciously going through to keep that airway open. And it's stressful. It's a low baseline level of stress. So to me, I would say that's the most important impact. And then there's dental ones. So, if your jaw doesn't grow correctly, you get teeth crowding. Cavities are also very common. Because the tongue can't reach certain places to clean the food off of the teeth in between teeth brushing. So yeah, there's a lot. Posture, that's another one. When the face and the airway don't grow properly, there's a hunching over that happens. There's a tension of the shoulders are pulled up and there's just all of this extra, just pulling of all of the musculature. And so what's really interesting is I've worked with adults when they've gotten their tongue ties released. And we've done what's called myofunctional therapy for their muscles. And you can just as that tongue tie is released, their whole body just relaxes. It's incredible. And they're like, whoa, wow, my shoulders are so low. It's all connected. There's fascia, there's muscles, it's all connected. And so much is controlled by the tongue.
Oh, I feel like you're talking to me about one of my children. Everything is sort of adding up. So it's really interesting to hear, isn't it? Because it's not just a tongue tie. It can affect so many different facets of life. So, and that just demonstrates the importance of identifying this early and then seeking the treatment options. And I'm sure they will vary depending on the severity, I guess, of the tongue tie. Is that correct?
It is actually. And that's something I really like to talk about because anytime there's a healthcare provider that gets educated on ties, there's a little bit of excitement, and just oh, let's treat all the ties, Yes, let's treat them. But treatment does not always mean a surgical release of the tie. So, when it comes to infants, right, you don't ever want to, well, I don't want to say ever. There's no absolutes when it comes to healthcare, but rarely do you want to just go and get that baby's tongue tie released by a dentist, a doctor, a midwife, whoever. That's generally not a good thing to do. The reason for that is because if you haven't begun trying to re-educate those muscles and in the latch and ensure that, there's a mom here too, right? So if she's dealing with low milk supply or clogged ducts or, she doesn't know how to achieve a good latch, we've got to do all that first, because if you get the baby's tongue tie released, it's like a reset button. It's like a chance for that baby to start fresh. And if you have that baby being brought to the breast with a poor latch technique, while they're going through this healing process, while they've had that tongue tie released, you're not providing the benefit that it should. We're just doing the same old thing and expecting different results. Just because you've changed the anatomy, it doesn't automatically create a better outcome. And I think that's what a lot of parents miss. Now, there are times where the baby just physically cannot eat enough, no matter if it's bottle or breast. And yet let's go get that released and then we can work on all the other stuff. So, but that's rare. So yeah, anyway, you would kind of know, right, with your healthcare team there, that would be pretty obvious. But yeah, even with adults, you've had, if you're in your 30s, you've had 3 decades of doing things incorrectly. If you think that you're going to go and get your tongue tie release, you are in for a lot of pain and a lot of you don't know what to do with your tongue. I cannot tell you how shaky your tongue will be, how swollen it will be, how much pain you will be in if you have not done the therapeutic work ahead of time. So a baby, thankfully, does not have, they recover much quickly. They don't have all the years of, improper muscle use and things of that nature. But yeah, it's, should you always treat the tongue tie? Here's the thing. If you work with, a skilled IBCLC who will tell you whether or not you need other people to be involved in this treatment plan, right? Let's say you get enough improvement from that the latch technique, maybe there's oral exercises, there's, some body exercises you're doing with your baby, what have you, right? Like you've learned to manage some of this stuff and you've gotten enough improvement that at that point, it's well, if we can only get 10% more improvement or 20% more improvement by going and getting the tongue tie surgically released, is that really worth it? It's painful for the baby. There's a recovery process that has to go really well. You are going to have to go in there several times a day and lift your baby's tongue and make sure that wound stays open and doesn't grow back and reattach to what it was before the procedure was done, because we don't put babies under general anesthesia. We don't do stitches. It's way too risky. So there's this cost benefit analysis that happens. It's is there enough improvement? And if there is, okay, maybe we don't need to surgically treat. If not, then we know it's absolutely necessary. And then there's the other thing, which is, parents get to decide. Right. And I think it's important if you just kind of know, okay, we've gotten as much improvement as we can. I'm comfortable with that. But I should definitely keep an eye out as my child grows to look out for these issues. If they're, going to the dentist and they're 7 years old and we're already looking at braces, okay, well, maybe we should be looking at, treating the tongue tie at that age.
Okay. A lot. That's, amazing. A lot of stuff there. Food for thought.
Yeah.
So I don't know if I've got a follow-up question. I feel like we have talked through everything plus more of what I had planned. So to wrap up, have you got any final, is there anything we haven't discussed that you do just want to let listeners know?
Yeah.
To finish off with?
I'll say that, tongue tie is what's really going to be responsible for most of the symptoms that stem from having oral ties, but there are lip ties, typically upper lip ties. There are buccal ties, and those do also cause breastfeeding problems. They don't cause the same number or degree of breastfeeding problems, but they're important. And so, a lip tie is more likely to cause breastfeeding pain, less likely to cause a lot of the other issues because we're just talking about a lip that should generally be at rest and just create a seal around the breast or the bottle. It's not swallowing. It's not doing all the other, way more advanced things. But it's important to make sure that you're treating all the ties if they exist and they're causing problems. Treating only one of the ties and deciding to leave the rest. I have never, ever seen that work out well. And I have worked with a lot of tied people. I've assisted in a dental office with doing the frenectomy procedure and being able to see the immediate pre-op and post-op outcomes. It's just, I would just say, don't think it's only tongue tie or don't think it's only lip tie. And then also lip ties and buccal ties, especially buccal ties, really don't exist without a tongue tie. So if you're thinking, well, my baby only has a lip tie, I would say that you probably want to get a second opinion on that because it's very, very likely they also have a tongue tie. So that would be my last piece.
Okay. And second opinion from IBLC, I always get that wrong.
Lactation consultant for short, but yes, IBCLC, because, and it's not you don't have to, work with me, we're everywhere, right? Whoever is, but it's because an IBCLC is the only credential out there for lactation that makes somebody an actual clinician and a healthcare provider, where we have supervised clinical hours. We have a board exam that we pass. There are other lactation certifications that allow people to teach, to counsel you. They don't allow that person to do something more advanced. And then kind of the issue with like OBs and midwives do know basic newborn care, of course, but OBs are focused on the mother and the woman and her health. Pediatricians are focused on the infant and that baby's health. And so there's like this, breastfeeding is two people. So I think, I just haven't seen there are exceptions, of course, right? Dentists are really typically a great option if you're wanting to get somebody that might know more about ties, but an IBCLC, if you're breastfeeding, even if you're bottle feeding, we work with that as well. That's going to be kind of the one-stop shop where you go, this person is going to know both the lactation and breastfeeding side of things, plus the oral ties side of things, and then kind of help me navigate and communicate with all these other pieces if they need to be involved.
Amazing, Jacqueline. Thank you. We'll leave it there. That has been, I trust that has been really valuable to any mums or parents listening who are concerned about their babies feeding and specifically any tongue tie. So thank you so much for joining me today. I really do appreciate you taking time out.
Yeah, thank you so much for having me. I'm excited to chat about this. And hopefully this is helpful for your listeners and everyone's learned something new.
Brilliant. Well, thank you so much. I'll leave all your contact details in the show notes. So if you're listening, don't hesitate to reach out to Jacqueline and say hello on Instagram. And thanks again. We'll see you soon, Jacqueline.
Thank you.
That's it, ladies. Before I sign off, remember my team and I will be putting together the show notes for this episode with all the links, including how to connect with Jacqueline and also her podcast episode on tongue ties in adults. Just head to fitnessedmama.com/podcast and the link is in the show notes. That's it, ladies. Have a fabulous day and I look forward to you joining me next week for another episode of the Fitnessed Mama podcast. Thanks for listening to the Fitnessed Mama podcast, brought to you by the Fitnessed Mama freebies found at www.fitnessedmama.com/free. So please take a few seconds to leave a review, subscribe so you don't miss an episode, and be sure to take a screenshot of this podcast, upload it to your social media, and tag me at Fitnessed Mama so I can give you a shout out too. Until next time, remember, an active pregnancy, confident childbirth, and strong postnatal recovery is something that you deserve. Remember our disclaimer, materials and contents in this podcast are intended as general information only and shouldn't substitute any medical advice, diagnosis or treatment. I'll see you soon.